Did you know that prostate cancer ranks as one of the top threats to men's health? Globally, shockingly, over 1.4 million new cases are diagnosed each year, and it remains a leading cause of cancer deaths among men. Step 7. Yet countless individuals fail to recognize the early signs that could save their lives today. Unhealthy every day. We'll delve into this critical topic. The subtle symptoms. You should never ignore the key risk factors that could put you in danger, and the life-saving prevention strategies every man must know. Stick with us until the end, because understanding these crucial facts could be the difference between early treatment and facing severe complications. The vital role of the prostate. This small yet mighty gland located just beneath the bladder and in front of the rectum plays an essential role in male fertility by producing the fluid that nourishes and protects sperm. Despite its small size and imbalance in the prostate, whether due to inflammation like prostatitis or the appearance of abnormal cells, can have devastating effects on the body. Prostate cancer develops when cells in this gland mutate and multiply uncontrollably, forming a tumor that may spread to other organs such as the bones or lymph nodes in aggressive cases, while the disease often progresses slowly. Its potential to turn deadly should not be underestimated. Knowing where the prostate is and understanding its function is your first line of defense against this silent killer. Why early detection is a game changer. Detecting prostate cancer in its early stages dramatically improves the chances of successful treatment, with survival rates exceeding 90% when caught early. Unfortunately, the disease often begins without noticeable symptoms, leaving many men unaware they are living with it. This is why routine screening, including the PSA prostate-specific antigen blood test and the digital rectal exam, is crucial. Despite the life-saving benefits, stigma and fear still prevent many men from seeking these evaluations. At Healthy Every Day, we stress this vital message. Your health is more important than embarrassment. Healthy, breaking through cultural barriers and embracing these screenings could be the key to saving your life. What increases your risk? Prostate cancer does not strike randomly. It targets specific groups at higher rates. If you are over 50, your risk climbs significantly. Alarmingly, men with a family history of the disease are 2 to 3 times more likely to develop it. Ethnicity also plays a role with black men facing the highest incidence and more aggressive forms of the disease. Lifestyle choices further compound the danger. Diets rich in fatty red meats, lack of physical activity and obesity create the perfect conditions for cancerous cells to thrive. The good news: simple changes like incorporating a nutrient-rich diet and staying active could lower your risk. Remember, every small effort counts in the fight against this dangerous disease. Symptom 1. Changes in urine stream. The first symptom many men notice when the prostate begins to enlarge or experience some imbalance is a change in urinary flow. There may be difficulty starting urination, a weaker urine stream, or even interruptions in the middle of bladder emptying. C-tablet using 1.5 grain of sugar. The sensation of not being able to completely empty the bladder can cause discomfort and anxiety. Although these signs are often associated with a benign condition called prostatic hyperplasia, they can also be indicators of prostate cancer, especially in its early stages. Therefore, if you notice changes in your urine stream pattern, stay vigilant and seek medical evaluation. The sooner the cause is identified, the better the chances for effective treatment. Symptom 2. Increased nighttime urination frequency. Another symptom that many men tend to ignore is the need to wake up several times during the night to urinate, a condition known as noctua. This can be linked to various causes, including infections, poorly controlled diabetes, and of course prostate changes when the gland enlarges. It exerts pressure on the blood ladder, triggering the frequent urge to urinate. Interrupted sleep due to bathroom trips affects quality of life, leading to excessive fatigue and irritability. While it may seem normal with advancing age, it should not be underestimated if the situation worsens or is accompanied by other symptoms, such as pain or burning during urination. It is crucial to seek medical advice to rule out more serious problems. Symptom 3. Presence of blood in urine or semenhemia, blood in the urine or hemospermia. Blood in the semen are warning signs that should never be ignored. While they may have various origins including urinary infections, kidney stones and other conditions, when linked to the prostate, they could indicate the presence of tumor lesions. This symptom, when caused by cancer, often appears in more advanced stages. Although each body responds differently, it is essential to remain calm if you notice blood and bodily fluids and seek clinical evaluation promptly. Imaging tests, laboratory analyses, and sometimes a biopsy will be critical to identifying the source of the bleeding. Even if the cause is not malignant, no apparent bleeding should be overlooked without investigation. Symptom 4. Pelvic pain or discomfort. Many people associate pelvic pain with inflammation or muscular issues, but it's important to remember that the pelvic region houses various organs including the prostate. A feeling of heaviness, discomfort, or even sharp pain in the lower abdomen, lower back or genital area may be related to tumor growth. This discomfort can radiate to the back, making simple tasks such as walking or sitting for extended periods is challenging. In advanced stages, the pain can become constant. Patients often confuse this symptom with muscular pain, which delays seeking help. Therefore, never underestimate persistent pain in the pelvic or lower back region, as it could signal something more serious. Symptom 5. Changes in ejaculation. Prostate cancer can directly affect the processes involved in producing seminal fluid and releasing leeing sperm. Some men notice a reduction in semen volume or experience pain during ejaculation. These episodes might be mistaken for infections, but persistent symptoms deserve attention. In some cases, the tumor compresses nearby structures, altering the function of the ducts responsible for conducting semen. This can result in changes in texture, color, or fluid quantity. If this condition persists for weeks or worsens, it's time to seek professional evaluation. It's worth noting that many prostate cancer cases are diagnosed at this stage, even before the manifestation of more evident urinary symptoms. Symptoms 6. Difficulty maintaining an erection. Erectile function relies on a complex set of factors, including the health of blood vessels, the nervous system, and of course the prostate. If the prostate is healthy, while erectile dysfunction can have many causes, such as diabetes, circulatory problems, and medication use, changes in the prostate gland can also play a role. Growing tumor cells can interfere with blood flow to the corpora cavernosa of the penis, impairing erections. If a growing bout is left untreated, when erectile dysfunction appears suddenly or progressively worsens, it warrants investigation. A simple checkup with a urologist can determine whether the cause is related to prostate cancer or another health issue. Seeking help early has the advantage of better managing complications and improving quality of life. Regardless of the problem's origin, a dramatic improvement in the quality of life is associated with seeking help. Symptom 7. Feeling of bladder pressure. A common complaint among men with prostate issues is the constant sensation of a full bladder, even after urinating. And this occurs because prostate growth or inflammation can create a partial obstruction to complete urine release, causing residual pressure in the pelvic region. Frequently, men end up straining their abdominal muscles to urinate, which adds to the discomfort. This symptom should not be overlooked, as it can lead to complications such as recurrent urinary infections, since residual urine in the bladder encourages bacterial growth, in addition to disrupting daily life. This condition can worsen existing symptoms such as nocturia. If the symptom persists, the best course of action is to consult the specialist and undergo imaging and laboratory tests. Symptom 8. Unexplained weight loss in many oncological diseases. Unintentional weight loss stands out as a warning sign. Prostate cancer, especially in advanced stages, can trigger metabolic changes and loss of appetite. Many individuals with prostate cancer can possess up to 20 times the usual body weight and act. Although this symptom is more commonly associated with aggressive tumors, it is essential to pay attention to any sudden changes in body weight loss of muscle mass and fat. Without apparent reason is often accompanied by constant fatigue, paleness and weakness. If you notice your clothes fitting looser and your appetite diminishing without a clear cause, it's worth investigating the situation. Other health issues, such as hyperthyroidism and gastrointestinal disorders, can also lead to weight loss, underscoring the importance of comprehensive medical evaluations. Symptom 9. Fatigue and persistent time tiredness, the sensation of relentless fatigue. Even during routine activities can have numerous causes. However, when a tumor is growing, the body often redirects significant energy to fight the problem or struggles with metabolic changes that hinder nutrient absorption and tissue oxygenation. As a result, fatigue becomes an almost daily reality. Men who experience a noticeable decline in energy without changes in habits or stressful routines should consider the possibility of investigating their prostate health. This generalized weakness impacts productivity, mood, and quality of life, especially when combined with other symptoms. Even though fatigue is a non-specific sign, it should not be ignored. The critical role of routine exams. Prostate cancer doesn't announce itself loudly. It often starts with subtle changes that only routine exams can uncover. Two pivotal tests stand out in the fight against this disease: the PSA, prostate-specific antigen test, and the digital rectal exam. The PSA test involves a simple blood draw to measure the levels of a protein produced by the prostate. While elevated PSA levels don't always mean cancer, they can act as a critical warning sign. Meanwhile, the digital rectal exam allows doctors to assess the prostate's texture, size and shape, detecting abnormalities that might otherwise go unnoticed together. These tests significantly improve the accuracy of diagnosing prostate cancer for even more precise detection. Doctors may recommend advanced imaging, such as a transrectal ultrasound or MRI. Men over 50 or those over 45 with risk factors should prioritize these evaluations. After all, early detection can mean the difference between a simple treatment plan and a life-threatening diagnosis. What comes after diagnosis? If routine exams and biopsies confirm prostate cancer, the journey doesn't end. It's just the beginning of personalized care. Determining the tumor's stage and severity guides the choice of treatment, which could include surgery, radiation, therapy, hormone therapy, or chemotherapy. Each approach is tailored to the cancer's aggressiveness, the patient's age, and overall health. For localized prostate cancer confined to the gland, cure rates are incredibly high, often exceeding 90%. However, every case is unique. Open communication with your healthcare team and considering second opinions can empower you to make informed decisions and ease the uncertainty. The range of possible causes of cancer extends, and each case consists of 33 genes or less than 100,000 organisms. Treatment options and their challenges. When it comes to treating prostate cancer, each option brings both promise and challenges. A radical prostatectomy, removing the prostate, offers a potential cure for localized cancer, but may lead to side effects like urinary incontinence or erectile dysfunction. Radiation therapy, whether external or internal. Brachytherapy targets tumor cells with precision, but can cause bladder irritation, rectal discomfort, or fatigue. Hormone therapy works by reducing testosterone levels, a hormone that fuels prostate cancer growth. While effective, it may lead to hot flashes, decreased bone density, or changes in libido. Chemotherapy, type AL reserved for advanced stages, targets cancer cells that have spread, but often comes with significant physical tolls. Despite these challenges, treatments are highly effective when applied at the right time, emphasizing the importance of early diagnosis, preserving quality of life during treatment. Fighting prostate cancer doesn't just mean treating the disease. It's about maintaining a fulfilling life. Physical recovery can be supported through pelvic physiotherapy to improve bladder control and supervised exercise to build strength and stamina. Nutritional guidance, focusing on immune-boosting foods, helps the body remain resilient during treatment. Just as crucial is emotional well-being, leaning on loved ones, joining support groups, or seeking professional counseling can reduce the psychological weight of the journey. Facing this battle alone can amplify fear and anxiety, so don't hesitate to reach out for help. Nutrition, a powerful ally in prevention. A healthy diet isn't just about staying fit. It's a frontline defense against prostate cancer. Studies show that eating plenty of fruits, vegetables, legumes, and whole grains provides the body with antioxidants and nutrients that combat harmful free radicals. Conversely, diets heavy and fatty, red meats, processed foods, and sugars fuel inflammation, creating fertile ground for cancer cells to grow. The Mediterranean diet, rich in olive oil, fish, and vegetables, has been shown to protect men's health. Moderate consumption of soy products has also gained attention for its potential hormonal benefits. Every bite counts when it comes to prevention. Beyond diet, good health habits extend far beyond the dinner table. Regular exercise reduces chronic inflammation, strengthens the immune system, and regulates insulin levels, all of which help ward off cancer. On the flip side, a sedentary lifestyle can disrupt hormone production and encourage tumor development. Whether it's walking, swimming, or cycling, find an activity you enjoy and stick with it. Caring for your mental health is just as vital. Chronic stress can worsen inflammation and increase cancer risk. Prioritizing relaxation and finding balance in your routine can make a world of difference. Breaking the stigma, open conversations save lives. For many men, the fear of discussing prostate health prevents early diagnosis. The digital rectal exam, while uncomfortable for some, is a quick and essential procedure that can detect life-threatening changes. Movements like Member aim to destigmatize men's health by encouraging open dialogue and proactive action. By sharing knowledge and experiences with friends, family, or community members, we can help break down cultural barriers and save lives. Remember, the earlier prostate cancer is detected, the better the outcomes, and there's no shame in prioritizing your health. Prostate cancer is a silent battle that many men face, but with the right mindset and actions, it's a fight that can be won. Whether you're undergoing treatment, recently discharged, or simply taking preventive measures, vigilance is your greatest ally. Regular checkups, routine blood tests, and imaging scans may seem intimidating, but they are your best tools for catching changes early, giving you a better chance at effective and timely interventions. In case you are worried about your health and well-being, try getting lab testing after each meal. The truth is, prostate cancer doesn't have to be a life sentence. Early diagnosis brings hope, with cure rates now exceeding 90%, thanks to medical breakthroughs and ever-improving treatment protocols. Each new day in medicine offers advanced technologies and techniques designed to save lives. If you've experienced unusual symptoms or have a family history of prostate cancer, don't wait. Your health is worth every effort. If you found this information helpful, don't forget to like this video, Subscribe to our channel Healthy Every Day and hit the notification bell so you never miss critical updates on men's health and well-being. Together, we can spread awareness and empower more people to live healthier, happier lives. Thank you for watching and take care of your health. It's your most valuable asset.